There's a lot of confusion around acupuncturists. Who are these people? What are their credentials? Why should I be listening to them? Are they doctors or are they massage therapists? I want to clarify all of this for you. We're going to go through the details in regards to what the schooling is to prepare to become an acupuncturist, what their titles are, and how we incorporate them into our personalized, individualized healthcare plans. So I think I will start this conversation first by explaining what acupuncturists are not. There is some confusion in regards to whether we are doctors, i.e. medical doctors, and we are not. We are not medical doctors. We are not physicians. We do not, in our scope, diagnose within that allopathic biomedical paradigm regarding a disease. Someone comes to me and I will first and foremost do all of my history and my pattern differentiation, and I will suspect things according to the patterns that I find. So my diagnosis lives in the East Asian medicine world, and that's a pattern, and it will make no sense when I tell you all those names, but it will to me in regards to my treatment plan. But I will also recognize that there are patterns and parallels that will infer to a diagnosis within your allopathic and biomedical paradigm. Whereas I will not diagnose, but I will refer out to a medical doctor or your physician, and they will then do that for us. That's what they are there for. That's what they do. And from there, they will oftentimes do something else that they do that we do not do, which is prescribe any kind of prescription or pharmaceutical medication. It is not in our scope to prescribe medications and prescriptions in that paradigm, so that's where you're going to go for that. They are medical doctors. They go to school for that allopathic biomedical paradigm. They go to school to learn all about medications and the appropriate medications for the different diagnoses in that paradigm. They will refer out specifically as needed amongst those specialties, and they are all usually medical doctors, MDs. The confusion lies in the licensure for acupuncturists. We're coming a long way in our country in regards to having acupuncture being more accessible. In fact, I believe it was about just 50 years ago that it wasn't even legal to do this medicine. But now we actually have some licensure, and it started off with a licensed acupuncturist, and that is the title. So the majority of acupuncturists that you go to will have an LAC at the back of their name, and that's a licensed acupuncturist. As we've learned and as we've grown, we now have further education, and we have a doctorate, and we have a doctor of acupuncture and Chinese medicine or a doctor of Oriental medicine. That is not a doctor, i.e. medical doctor, that relates to the schooling and the education that we've received, i.e. a PhD would have the doctor before their name. So when you go to someone and they say that they are a doctor of acupuncture and Chinese medicine, that means that they have done quite a great deal of schooling. And so going back a step in regarding to the education process, there is a lot of parallels between the medical doctor and us in the amount of time spent, the classes taken, and the internships and externships. I will speak from my own experience because I'm in California. California has high standards in regards to the amount of education that you need in order to receive your licensure. So what I went through in California, and what many do, is that we go to school, and we go to school I went to school for 11 trimesters, no summers off. That was just shy of 4 years, and I had a full load most of that time, over 18 credits, and I was taking both lessons and education in the biomedical world, where I learned all of my anatomy. We did biology, we do biochemistry, we do neuro, we do pathophysiology. I went through clinical classes in regards to taking intakes, taking vitals, differentiating between different diagnoses that do live within the world of medical doctors so that we can identify red flags. I also took classes in the different lab work, understanding the mechanics of the body and how it works, and what lab work would be recommended for different diagnoses in order to identify them, and just so I know when I have a patient that's coming in, and if there's something that I think is maybe needing some pharmaceutical support, then I'm going to refer that out to a medical doctor to do so. But I'm just letting you know all those classes are within my scope and what we take. In addition to that, we take an entire second major at the same time, learning about the theories and the history behind the East Asian medicine and the acupuncture points, which there's hundreds of them, and then learning their location, learning their depths, learning their functions, learning when to do them, when not to do them. And then in California, we also have a mandatory herbal board to sit down for. Not every state is an herbalist as well as an acupuncturist, but in California they are, which then you're now sitting down and you're learning every herb, not every herb, but a large hundreds of herbs, single herbs, and you're learning again what their functions are, what their temperatures are, what channels they go to, what their interactions are. And then you're learning how to put those into customized formulas. And there are some formulas that are already pre-done and they've been around for centuries, and we learn about those and how to pattern differentiate in order to utilize those formulas for whatever treatment we're looking for. So it really is this double major, and that's why it takes so long. Oftentimes people think, oh, it's an acupuncturist, they're a body worker, they go to school for a year. Actually, they go to school for almost 4 years, and that's only if they're using full-time 18 credits. So many people can't do that, and it takes much longer than that. And that's just for the licensure and for the master's program, which is what I did. And now people go and have even longer education and schooling in regards to getting their doctorate. And the doctorate is, again, another 2 to 3 trimesters, another year, where you are going a little bit more in depth in regards to working integratively with your medical doctors, talking about more lab work and going again into a deeper level into the medicine in order to integrate this medicine with the allopathic biomedical paradigm that we know. So I went to school for almost 5 years, and that's where I, within that time, same as our medical doctors, not exactly the same actually, but there's some parallels, is that we do some internships and externships. It is not as severe, I will say, as the medical doctors who are spending 12-hour shifts in an emergency room. I have lots of nurses and doctors, and I know the grueling aspect of those internships and externships. It is not like that. However, we do have internships and externships within our field, where we do take in-house internships where we are with other providers and we follow them and we learn that way. And then there's also externships where, for example, myself, I did some externships with REMAC over, and I worked at sports medicine down in Ocean Beach, great sports medicine clinic. And then I also worked with Circle of Living, shout out to them, over in, I think that's University Heights. And then I also worked under Dr. Corradino over in Poway and Palmerado Hospital under his clinic that was attached to that hospital. Once you have those degrees, which is a Master's of Science or a Doctor of Acupuncture and Chinese Medicine, that's when you can then sit for your boards. Very similar to your medical doctor, you are also, as a licensed acupuncturist or a doctor of acupuncture, going to sit down and have your boards. And those boards cover the biomedical aspect, they cover the East Asian medicine aspect, they cover the herbal aspect if you live in certain states that have that as a requirement. And they're an all-day affair, and they're intense, and they're not easy. And the success rate for an acupuncturist who starts the program and finishes is very low. I think that a lot of people think that it's something that's maybe a year commitment or it'll be really cool and fun, and it really is. But it's also grueling, a lot of memorization, and a challenging career to go into, although very rewarding. But how do we incorporate these medical doctors with our integrative doctors? And this is the most important takeaway, is understanding that one should not be in place or in lieu of the other. I believe that these providers, medical doctors and integrative providers like myself, whether it be a doctor of acupuncture, we have naturopaths, there's osteopaths, there's chiropractors, there's so many functional doctors that can work together in your team to help catch the aspects of your personalized healthcare plan. I think it's critical that you have an integrative healthcare provider, i.e. an acupuncturist, a naturopath, osteopath, etc., chiropractor, who looks at you on a regular basis, who's catching the little misalignments. And if we can catch those before they get to be chronic conditions, that's what we're looking for. And then we have our medical doctor to be looking at their perspective and catching the red flags in severe cases.
Thank you for listening and being a part of the conversation today. If you enjoyed it, please like us or leave a comment in the comment section. We would love your feedback, and we are open to topics that you would like to discuss. And better yet, if you know anyone that may benefit from this information, either they're suffering, they're in pain, or they're just curious about trying this medicine but they don't like needles, please share this podcast. As I always say, wellness is as contagious as the flu.